All right, we're taping.
Okay, this is my essay on depression, my speech. Depression is such a horrible imposter within someone's mind, especially when talking about teenagers. As a parent, we try our hardest to make the right decision for our children. When our child is feeling bad, we do the best we can do to make them feel better. When a child has been stricken with depression, sometimes the parents are the last to accept that their child is depressed. Depression is not prejudice. Depression strikes children that come from wealthy homes as well as poor homes. It strikes anyone at any age at any time. Teenagers are generally moody. They're going through puberty and just trying to fit in, and this is a normal learning process that all teenagers will go through. This is an important part of teenagers' social development. The unfortunate part of social learning process affects some teenagers much more differently than others. There are teenagers that definitely go through a depression stage and manage to work it out themselves. There are some teenagers that just cannot grasp the pressures of life. The pressures grab a hold and just doesn't let go. Depression begins to consume these individuals and their lives, virtually taking over everything. Teenagers are so pressured into growing up too fast. Unfortunately, society, peers, and even parents are guilty of this extreme pressures of adulthood. We all struggle with the age-old question, what is life? The struggles that we all go through to find these answers can be very stressful and exhausting. Depression is a medical term which is an abnormal emotional state, which is exaggerated feelings of sadness, melancholy, worthlessness, rejection, emptiness, and hopelessness, which simply just means feeling really horrible about oneself and their life. It's hard to determine real depression by really sad feelings. The sad feelings usually pass in a few days, but depression just builds and gets worse. There are two types of depression, dysthymic disorder and major depression. Dysthymic disorder, which is also referred to as a chronic depression, is not generally linked to one specific event that just continues on. A person diagnosed with this disorder may be moody, not eating, sleeps too much, and their energy level are very low. Their self-esteem is low. Dysthymic disorder is only one half as common major depression, but lasts much, much longer. Major depression is described as a whole body illness. It affects much more than just the mind. Major depression can strike suddenly or slowly. So many different things and situations can cause it. This cause could be a chemical imbalance which affects the brain, or it can be a genetic pattern from the family. Depression can also be triggered by a death in the family, a divorce among the parents, or just basic trials in life. The rates in depression among teens are about 1.5 million. 3 guys for every girl suffer from depression. The cause of depression is really not known. It's not like a cold that you can just catch from someone else, and sometimes the depression never goes away and needs medication to treat it. Depression can unfortunately result in taking one's own life, suicide, which is the third lead causing of death among people 15 to 24. About 5,000 teens commit suicide each year. There are about 30 to 50 unsuccessful attempts for every one completed. Most of these teens that end up committing suicide usually have a drug or an alcohol problem. Treating depression is generally used with therapy and medicine, and it is highly recommended that a person that has depression exercise, work out, or do some sort of physical activity. This can reduce depression by chemicals released by the brain to help a person feel better. Depression is very serious and should be taken serious, even if the person is using it just to cry out for help. People live with depression every day by using methods of therapy and medicines. Thank you very much.